Hey, welcome back, everybody. It's Dr. Z. Let's talk about one of the most annoying things to deal with for patients that I see all the time in the urgent clinic, and that's a lingering cough. You might have gotten sick, and now your fever's gone, your nose is cleared up, your energy's mostly back to normal. You're not feeling like you were hit by a truck, but you have this very annoying, lingering cough that just does not seem to want to go away. And I have patients come in all the time. They've been dealing with it for 2 or 3 weeks. They're wondering if they have pneumonia. Do they need antibiotics? Do they need an inhaler? And they're usually a bit disappointed in most of my answers, which is that in most cases, it's a simple post-viral cough. And unfortunately, there's not a whole lot we can do about this. The main treatment is going to be time. But we'll talk about what the causes are and what some of the more serious causes are and what we can do to get rid of this cough. So when it comes to the timelines, we would consider, as far as the guidelines say, an acute cough is going to be anything less than 3 weeks. Subacute is going to be 3 to 8 weeks. And then over 8 weeks, that would be considered a chronic cough. And patients are usually quite surprised by this. They get concerned when they have a cough for more than a week. But as you can see, even up to 3 weeks is considered an acute cough. Most of the time, people coming in with a lingering cough, it's going to fall between that 3 to 8 week mark. And generally speaking, they feel better from every other perspective from when they initially got sick, but it's just this annoying cough that's bothering them at work. It can be a bit embarrassing if they're in a meeting and they start coughing, or if they're exercising, doing their hobbies, it starts acting up. Sometimes it can be worse at night and cause problems sleeping. So certainly very annoying to deal with, but usually, like I said, most of the time, it's not medically concerning in terms of the cause. However, the key takeaway here is that if you're within that 3 to 8 week window of having this post-viral cough, that's still within the normal recovery period according to the American College of Chest Physicians as well as the Canadian Medical Association. And that's why if you're a patient and you're going to your doctor and you're within that window, you might be a bit disappointed and feel like, hey, why are they not doing anything? It's because even though it feels like a long time, based on the evidence, based on the guidelines, this is still within that normal recovery window, unless you're having more serious symptoms along with it, which we'll come back to. Now, why does that cough linger? Most of the time when you have a cold or some kind of infection, it's going to be a virus that causes it. And it's not just going to make you feel unwell, it physically damages the lining of your airway. The epithelium, which is basically a protective single cell layer that coats your entire airway from your throat down to your upper airway to your lungs, it basically gets stripped down by that virus as well as your own cells that are trying to fight that virus there. Now, underneath that epithelium, you're going to have sensory nerve endings, and their entire job is to trigger a cough when something irritating touches them. So as that epithelial covering breaks down and those nerves are exposed, obviously they're going to be activated more, and that's what's causing the cough to come about. Another thing is, as you're dealing with the virus, you're going to produce more mucus, all that nasty green, yellow stuff coming out of your nose and coughing it up. And with normal mucus, you have these small little hair-like projections called cilia that move that mucus and cause it to clear. But because you're producing more mucus than normal and these cilia are getting damaged, they're clearing out less of it. And then you also have something called bronchial hyperresponsiveness. Your bronchioles are an airway or a type of airway, and they act hyperresponsively, or they're more sensitive when you're acutely dealing with an infection. And you combine all that together, that's why you have that lingering cough. You have this airway inflammation, the epithelium is damaged, the nerves are exposed, you have extra mucus, less cilia to clear them, more irritation, and then you have that hypersensitivity, and all of that results in that cough being triggered. And that's why patients might say things like, oh, I feel fine until I start talking, or cold air makes me cough, or I cough when I'm exercising, or once I start coughing, I can't stop, or my cough gets worse at night. Now that you understand the mechanism behind it, that's why it's happening. When you're laying down at night, there's more mucus in there, there's less clearing upwards, and that's why it's triggering the cough. So the key thing to understand there is that the initial infection that you had when you got sick, that was the trigger that caused all these things to come into play. But now this ongoing problem is because of the airway inflammation and all the things we talked about, not an active infection that's causing it. And for that epithelium to be healed, it's going to take weeks to do. And that's why the 3 to 8 weeks, it's not unusual to see that. And also the more risk factors you have, if you have COPD or asthma or allergies, or if you're a smoker, then all these mechanisms are even more active for you, and you're going to be at higher risk for developing a lingering cough and having it last longer, or potentially developing a complication. Now, whenever we're dealing with the lingering cough in the urgent clinic, like I said, patients are often frustrated because We're telling them they don't need antibiotics, but it's annoying them and they feel like if they just take some antibiotics, they're going to feel way better. But like we talked about, most uncomplicated respiratory infections are going to be viral and they don't require antibiotics regardless of how long that cough's been going on. We'll talk about when you do need antibiotics, but again, the antibiotics are not going to speed up that epithelium healing, those nerves going back down to their normal state of activation, the bronchial hypersensitivity, all the things we talked about. Antibiotics aren't going to touch that at all. So that's why your doctor's hesitant to give you them. It's easy for us. We just sign a paper and there you go, but it's exposing you unnecessarily to the complications and side effects of the antibiotic without actually giving you any benefit, if it is genuinely a post-viral cough that you have. Another myth is that if my mucus is green, then I must definitely need antibiotics, and that's not necessarily true either. It's a combination of factors, and that's why the diagnosis in the first place is important. Now, a lot of the time, people will be prescribed puffers like Ventolin or a steroid puffer or combination inhalers. And the evidence for routinely using these in otherwise healthy people without asthma or COPD, there's actually very weak evidence. There was a Cochrane review. It showed that inhaled corticosteroids for this kind of cough, there was no clear benefit. Canadian Medical Association doesn't recommend it. There's a study in the British Journal of General Practice in 2018. They didn't find any benefit either. So a lot of this becomes subjective. Some patients I've had do find benefit, and they found that it'll reduce their cough by a little bit and help temporarily, but largely puffers are helpful for people with already established asthma or COPD and will often increase their puffer dose or how many puffs they're taking per day when they're dealing with an infection or this kind of cough, and it can provide them some benefit sometimes. But in the normal, average, healthy adult without those medical conditions that are not smokers, there's no clear benefit. It's pretty much a Hail Mary. So let's talk about what we can actually do and what the evidence shows is actually helpful, and almost none of it is something that your doctor needs to give you. Now, patients don't like hearing this, and I understand why, but the number one treatment for this kind of thing, and a lot of things in medicine, is time. There's just no way around that. And again, depending on the risk factors you have, if you're a smoker, COPD, asthma, allergies, it's very likely going to take more time for you than it would in the normal, average, healthy adult. Now, making sure you're hydrated, those fluids are going to keep the secretions thinner and help clearance. So you should be hydrated in general, but especially when you're dealing with this kind of cough or an illness, make sure that you're getting your water in. Honey, there's been studies to show that it does reduce cough frequency compared to no treatment or placebo. And it actually had a similar effect to dextromethorphan, which is a cough syrup. And usually this help was seen within the first 3 days. Obviously, this is not for infants. You shouldn't be giving them honey, but it's a good conservative measure to try at home for everyone else. Lozenges or hard candy, these can help keep the throat moist and reduce irritation and that urge to cough. So the Canadian Lung Association does recommend these as a supportive measure. You can try to lower the irritants to your airways while you're dealing with this. So if you're a smoker or if you vape, don't do any of that. Avoid secondhand exposure, strong fragrances and fumes, very cold air. This isn't necessarily a treatment, but it's going to help prevent further damage and further irritation of that already damaged tissue. And then lastly, over-the-counter stuff, cough and cold medication. Just be careful with this. It's a very temporary relief. Again, it's not treating the damage. Time is going to do that. Your body's going to do that. This stuff is just helping you with the symptoms, and it's not a cure. And a lot of these medications your body can become reliant on. So it's only for 3 to 5 days maximum that we generally recommend using this. But you should always be checking the label and seeing what the recommended dosage and duration is. But again, it's not a treatment. It's just helping you with your symptoms. Now, we talked about the most average cases, which is just a simple post-viral cough, and time is really the only thing that's going to help take care of it. But now let's talk about what the other causes might be that might require a different approach and a different treatment. In some people, viruses will trigger asthma. So many people may not know that they have asthma until they're dealing with this stubborn post-infectious cough. And so if you're finding that you have a worse cough at nighttime or with exercise or cold air, and there's a family history of asthma or allergies, it might be worth a discussion with your physician to see if a workup is warranted. And in that case, puffers are going to be helpful for you. Postnasal drip or upper airway cough syndrome is a very common one. You might be noticing that you're clearing your throat a lot more. There's a sensation of dripping mucus at the back of your throat. There's a cobblestoning appearance at the back of the throat. That's very common as well. And usually that's going to require nasal sprays and sinus rinse to help clear that mucus and inflammation. So that's also worth looking out for. GERD or gastroesophageal reflux disease, it doesn't always come on with heartburn. Some people can have coughing as their presenting symptom. If you're noticing that it's worse when you lay flat or after meals or in the morning. Again, worth considering. You might need a PPI medication for this. If you're on ACE inhibitor medication like perindopril, lisinopril, if you just started that and it's a new medication for you and you have a cough, that is a very well-known side effect of that medication, so discuss that with your physician. You might just need a different class of blood pressure medication if you're not tolerating this one. It is a fairly common side effect that people have. Now, pertussis is another one. It's less common because most people are vaccinated against it. However, it's worth putting on here. It usually presents in paroxysms, meaning bursts of coughing that stack on top of each other without a breath in between. Sometimes it can lead to vomiting or feeling like you're nearly going to faint, and it's usually worse at night. And it's a bit tricky to diagnose because between these episodes, the person can look totally okay. And like I said, most people are vaccinated against pertussis, so it's increasingly uncommon. So usually when patients are having symptoms like what we spoke about for 2 weeks, doctors will consider pertussis as a possible cause. And then in that case, you need antibiotics. But even then, the antibiotics are more so about stopping transmission rather than actually helping you heal faster. Now, what about imaging? A lot of the time patients want chest x-rays or they're hoping to get that done, hoping it gives answers. And again, it's a case-by-case discussion with your physician. It is radiation in an x-ray, so you have to weigh the costs and benefits of that. For most post-viral coughs, you don't have a fever, you don't have other medical conditions, you don't feel short of breath, an x-ray is not really going to be helpful. If you're feeling increasingly short of breath, you have fevers, you're coughing up blood-tinged stuff, then an x-ray might help diagnose pneumonia, and that's an entirely different condition, obviously, and you're going to need antibiotics for that. So it really just depends. But when it comes to strictly a post-viral cough with none of the other complicating factors, an x-ray is really just going to be unnecessary radiation, and it's not going to change treatment at all. Now, there are some red flags worth considering. If you're coughing up blood, that's going to warrant some imaging. If you're significantly short of breath or you're having new chest pain, especially that gets worse with activity or exerting yourself, that might require imaging and a heart workup. If you have a persistent or recurring fever, that might point towards more of a bacterial source. Unintentional weight loss without trying, choking that's new for you, night sweats, these are all situations where there's going to be some kind of further workup and imaging that's needed to rule out things like bacterial infection, pneumonia, sepsis, or cancerous causes as alternatives to a simple virus causing your cough, as well as the trajectory of your symptoms. If you feel like you got to a point where you're feeling way better and then things have been declining since, that's a common story we hear when people unfortunately go from having a virus and it's turned into a superimposed bacterial infection. Now, we talked about the timelines earlier, and past 8 weeks, this is the point where there's more of a diagnostic requirement. You're going to want to get a chest x-ray, spirometry, which checks on the breathing patterns that you have, pulmonary function testing, that's going to help diagnose asthma or COPD, a medication review, and depending on these workups, you might be sent to a speech-language pathologist or a respirologist, depending on what comes back and what might be causing it. But point being, if you're past the 8-week point, it warrants a further workup to rule out those alternative causes. So the bottom line, again, 3 to 8 weeks with no fevers, otherwise healthy. Vast majority of cases, it's going to be a post-viral cough, and my patients are going to be annoyed with me that I'm not giving them anything to help with that. But now, as you know, time is going to be your number one friend, and then there's going to be a bunch of stuff you can do to help make that time more tolerable. However, if you're a smoker, if you have COPD, you have asthma, you have fevers, or any of those red flag things that we talked about, that warrants further workup and ruling out those more serious alternative diagnoses. So it's pretty much it for this one. I know post-viral cough or lingering cough, very annoying to deal with, but thankfully, in most cases, it's not medically concerning and it will get better. Hopefully that was helpful for you guys. Be sure to check out the description for our community and our newsletter. You can find us on any podcast platform so you can listen on the go. That community will be home to some resources we're working on. We already have a screening checklist on there to make sure that regardless of your age or gender, you're caught up on all the recommended screenings for cancers. And we're working on some more hopefully useful stuff for you guys, so be sure to check that out. Let us know what you want to hear about next. I'll see you next time. Cheers.